All right, this is skill 2.23, mixing medications using one syringe, okay? So mixing medications, taking more than one, so two medications, and mixing it into one syringe. So you're only having to give one shot. This is done a lot of times with insulin, okay? But I'm going to show you how to do it with a bigger syringe just for viewing purposes, okay? All right. So we're in the med room. We're not in the patient's room. We have taken the med from the cabinet. We've done all of the first checks, okay? We're gonna wash our hands and gather our supplies. So what are our supplies? Well, our supplies are going to be a few things. First of all, you need a needle and syringe, okay? You're going to need either 2 vials, okay? Or you're going to need a vial and an ampule, okay? All right. So if we have an ampule, then of course we need a filter needle, right? Because it's a glass, and we're gonna use filter needle, right? Okay. So we're gonna need an alcohol pad or 2. We're gonna need a label to label our medication, okay? And that's about all we need. Okay, so we're gonna prepare the medication ampule or vial for drug withdrawal. And if you've already looked at the other videos, you should know how to do that. Okay, we're gonna snap off the ampule cover, right? All right, I've already done that, okay? Then we're going to clean our multi-dose vial if it's already open, or snap the cover off, right? That's getting our medicine ready for our ampules or our vials ready for medication withdrawal, okay? So that's that. I'm sorry, I'm getting the ampule ready so I don't have to snap another one. There we go. All right. So we've got our medications ready. We've rotated them if we needed to rotate them. We've checked them, the dates, we've done everything, right? Okay, so they're all clean, they're all ready to go. I'm gonna show you how to mix 2 medications from 2 vials first, okay? So from each vial, you should know how much fluid or medicine you're taking out from each vial. All right, so let's say it's 1 milliliter from each vial, okay? So you will get your needle, take the cover off, draw back, and get air, okay? You want to bring it to at least 2 milliliters, right? So you want to instill air into vial A. Remember, we don't want to go into the medicine part, just into the air, and instill at least 1 milliliter of air into vial A, okay? That's done. Now we're going to take vial B, okay, and we're going to instill at least 1 milliliter of air into vial B, okay? Then we're going to take and invert that vial. So vial B we're going to turn over, and we're going to withdraw 1 milliliter of medicine from this vial, okay? 1 milliliter. Holding that plunger still, we're going to invert the needle, and we're going to push it into vial A. Now we're going to go back to A. We've already put the air in there, right? We're going to put our needle into there. We're going to invert everything, okay? And we're going to draw back to the 2 milliliter mark. So we're going to take out 1 milliliter of medicine from vial A. So be careful with this, because you cannot instill any medicine that was already in this syringe into here, because it's not the same medication. So you have to be careful. You have to slowly draw back. Okay, draw back. Keep going until you hit to the 2 milliliter mark. Okay, and take your needle out. So now you have in this syringe 2 milliliters worth of medicine, but you have 1 milliliter from each vial. You took 1 milliliter out of vial B first, correct? And then you added 1 milliliter from vial A into it. So now you have a mixture of medicine in this syringe. What do you do for labeling? Well, that's simple, okay? You're literally going to just put it on there. You're going to put 1 milliliter of a med, whatever it is, 1 milliliter of whatever that other medication is, okay? And then you're going to put the date, the time, and the initials, okay? All right. So then we take that label and we label our medication. All right? So now we have a combined medicine, okay? And we're going to take our 2 vials and our medicine, and we're going to go to our patient's room, and we're going to administer this medication. Why are you taking the vials? You're going to take the vials if your facility requires you to have them in order to scan the barcode, okay? Because some of them scan the barcode, and that will open the MAR correctly so that you can document, okay? So you may have to take the vials with you along with the medicine that is labeled to your patient's room. So that's how you mix medications using 1 syringe. Now, what happens if you have to mix medicines with a vial and a ampule? Okay, so do we have to put air into the ampule? No, we don't. Okay, do we have to put air into the vial? Yes, we do. Okay, so with the needle on, we're gonna draw back, and we're gonna do again 2 milliliters. 1 milliliter for the vial, 1 milliliter for the ampule. Okay, so what we're gonna do is we're going to instill 1 milliliter of air into the vial. Okay, I'm pushing the air into the vial. Okay, I'm going to invert the vial, and draw back on the plunger to get to the 1 milliliter mark. All right, I'm going to look to see if I have any bubbles that I need to get rid of. If I do, I'll get rid of them. Okay, now I have to get medicine from an ampule, which is glass, which means I now have to change my needle. So I'm going to change from the needle that I had on there to my filter needle. Okay, I'm going to put my filter needle on there. I'm going to make sure it's on snug. I'm going to take the cover off, and I'm going to leave the medicine on the counter, okay? And I'm going to draw back 1 milliliter. So I'm going to bring this plunger up to 2, right? There we go, okay? And you're going to push up. Make sure you have no bubbles, and you have 2 milliliters of fluid. Now, you cannot use this filter needle for administration into the patient, so you will have to replace this needle, this needle, with a needle that for administration, whether it's a sub-Q, whether it's an IM, okay? And then you would label it. So I would put on a new needle and label it. 1 milliliter of a certain medication, 1 milliliter of another medication, the date, the time, and my initials, okay? Again, if your facility requires you to have the medicine in order to scan it for the barcode, okay, you're going to take the medicine with you. If not, you can just take the syringe and you can go administer it at your patient's bedside, okay? That is how you mix medications, use from 2 vials or from 1 vial and 1 ampule, but that's how you mix medication using only 1 syringe, okay? So that was skill 2.23, mixing medications using 1 syringe.